are back and we're moving into our first conversation for this morning. As we said, it is Mental Health Awareness Month, and the conversation we're having this morning is focused on support systems for your mental health in the workplace. Yes, some workplaces do have it. And here to tell us more about these types of programs, because she is one of the practitioners for these programs, is Amy Jex, who is a counselor and also the president of the Mental Health Association. Good morning.
Hi, good morning. Thank you for having me, especially in the month of May. That is, we try to always bring awareness of mental health, and every so often we have these little things on the media that pop up that remind us how relevant it always is.
Yeah.
But, we have the hashtag End the Stigma, but it's very hard because we have such a huge barrier. That's largely the work of the MHA, to challenge the stigma in our community. And little by little over the years, like you said, there are a lot more workplaces who are understanding, who provide support.
And I want to dive right into that. It's called an employee assistance program. We've talked about it primarily from the government standpoint, and recently, they're working to improve upon that. It's a service they offer, but there are other workplaces as well. Tell us about how common it is in other parts of the world and how long agencies in Belize that have been doing it.
Well, to set that in context, you have to remember I've only been in Belize for about 10 years. Actually, May last week made 9 years that I have my office at Medical. So it's been a journey of getting to know what is being offered.
Yeah.
And I've been called by companies throughout the 9 years to respond to their employee queries, concerns from places in Cayo. I've actually driven down to Cayo. I've gone, most recently, I wasn't able to go, but a company called me out to go to Keycocker. And, in Belize City, sometimes I get referrals and people come in. And we have to remember that our bosses are sometimes tough, but they can be understanding too. And it ranges. Sometimes I get calls from schools. Sometimes I get calls from banks. Sometimes I get calls from, big workplaces in the communities. And sometimes they come from smaller offices, Even sometimes where I work, they say, I have a concern with this employee. What can I do?
Yeah.
And so there is an understanding of a purpose to mental health, a purpose to counseling for mental health. And very often, if you were to ask someone who works at the mental health unit, you'll hear that they work with a lot of other people as well. So sometimes businesses would call the Port Loyola Clinic and say, how can you assist us? And, they can vary again from the big companies to the small little ones. Yeah. Sometimes, small offices, accounting firms, law offices that aren't big. It's very hard for them to have something like an EAP program, because how would they, go into that?
Yeah. We're talking two things here, because one, we all do the math for ourselves. You spend so much of your time at work, and if you're not at work, you're thinking about work. And so the idea of being able to have a workplace offer that type of support program, some people in today's age might embrace that. But others may still be hesitant. Like, do I want my employer anywhere involved with what's really happening in my mind?
Yesterday, I was speaking to an employee who was referred to me, and I said, oh yes, I was talking to the EAP provider, and I sent the email and they responded to add more sessions, but I didn't check if the code was yours. And she said, oh, I'm a code? That's all I am? And that person was very happy with that, because you kind of think, when I seek these services, everybody and their bosses will know my business. And with another company, I was rushing and I put the person's summary on the invoice, and they came back to me immediately and said, please remove that confidential information, because they go to two different streams. One goes to billing, one goes to HR in the confidential P files. So I had to quickly redo it, and it was an oversight on my part, but I see how much companies care and employee assistance programs care about the confidentiality. At the end of the day, when a company takes the time to refer you to services, it's because they want the best for you.
Yeah. You know, it's when we look at how some of us were raised. You know, I know my mom taught me as work ethic. You reach the door of the workplace and you leave all personal stuff
Not
behind.
on time, 5 minutes early at least.
Yeah, and you leave it and then you shift to work mode. But in today's world, is that the reality? Can we actually just leave? If I'm going through a divorce, if I have, you know, substantial trauma happening in my life, is it realistic to ask people, leave that at home and come to work and just do work?
You know, some of us are better than others at compartmentalizing. It depends on our personality, and it also depends on the stressor.
Yeah.
Because like you said, something like maybe a sick child. How would you forget that your child is sick?
Yeah. Yeah.
But maybe something like maybe your aunt who's like living in one of the villages, she's sick. Okay, I can go in, and we did as much as we could for her over the weekend, and so I can shift into work mode. Not that I don't care for my distant aunt.
Yeah.
It's just easier to separate and to kind of set aside. So if we can think of those kinds of things, we can see there are certain things that we have to learn to cope with better than with other things. When we look at the ones that we can't forget, what we tend to do, or at least the clients I've worked with over the many years tend to do, is try to hide it in a closet. That's the image I use. You hide it in the closet and pretend it doesn't exist. But that doesn't work most of the time when it's something very close to you, because it's too big to keep inside a closet.
Yeah.
Right? So what we have to remember is, for some things you have to learn to address in the spot, give yourself time to process and move on. Because when you're distracted, we tend to want to forget. But the saying is, the more you try not to think about the pink elephant, the more you remember it, right? So we have to think of things like that. So you have to have different strategies, and if one thing isn't working, you try something else.
Yeah.
Yeah, I would imagine that if you don't have a place to go and speak, then of course you'll hold things in and you won't let it out. But I wanted to ask, so with that being said, usually when you get your clients, what point do you find they are already at in their whole compartmentalizing? You find that they're already at an advanced stage where this thing has become a
With
crisis?
EAP, it's very tricky, right? Because these people are referred. Their workplace is calling me and saying, I believe this person needs therapy, or I believe this person needs to talk. So let's imagine you experience a traumatic incident. And you experience a traumatic incident, like let's say at Easter. And you haven't talked to anybody. Easter was about a month ago, right? So you have been dealing with this on your own. You haven't told your parents, your family. You've been talking, but not processing it. So your boss gets to the point where your boss observes, you know what? You're not your usual self. I want you to go talk to someone. So your boss contacts HR. HR contacts me. We set up a first appointment. It very much depends on you. So there are some people who are referred and are ready to talk. There are some people who are referred who haven't even started the process of thinking what happened. They've just been trying to push everything away. And so what I usually do is, with some companies, I usually start out with 8 sessions. With other companies, I start out with 3. So we have a commitment of 8 sessions or 3 sessions, and we see from there how much we can do. Depending on what your progress was, I would recommend, let's add 3 more sessions, or let's add 8 more sessions, or sometimes I say you only need 4 more. And those 3 sessions, sometimes I do the 3 sessions in 1 week, because that's how much, once you start opening that closet door, that's how much you need to process. So I'd usually continue. For some people, I see you're good and I say, you know what, let's meet next week to see how you're doing, or in 2 weeks' time. And it really depends on the person, and it depends on how far they are. Remember, when you go to therapy, it's not about the counselor, it's not about the therapist, it's about you and your journey. So if you talk to a therapist who says, well, you know, your boss wants you to be fixed within 2 months, that's not going to happen.
Yeah.
And very often, I don't want to say very often, but on some occasions, I don't even need all the sessions, you know, because what you just needed was a space to kind of talk it out and give yourself tips on how to do it differently. Whereas some people finish the 8 sessions and we take a little bit of a break, and then they renew another 8 sessions and we talk for an extended period of time.
Does this session become compulsory once you have an EAP in your company? Let's say your boss says, I think my employee needs to talk, and I'll refer, or I'll reach out, but at the same time the employee sits there like, nah,
I've
cool.
had one occasion where it was compulsory.
Okay.
And the person said, I don't think I'm the person who needs to be here. It was a very complicated situation. And the person said, I don't think, I think it's someone else who needs to be there. I don't know who it is, but it's not me. And I said, well, you're in counseling, your workplace is paying for it, or at least let's see what your issues are, you know. And so it's about developing rapport with the client and figuring out what that person needs. I want to add something because we haven't really mentioned it, but a lot of EAPs offer counseling for family members as well.
Oh.
Not all, but many of them do. So sometimes you are referred, but there are occasions where you can go to your boss and say, you know, I want to talk to somebody. I don't know how to go around getting counseling. And the boss will go to HR, and the HR will say, you know what, let's do counseling for this person. And on occasions, you can go to your boss and say, you know, my husband or my spouse or my child, I think, are going through a situation, and I'm thinking about counseling for them. And sometimes you go through HR and they offer services for family members as well. I mean, it's very much on the judgment of the EAP provider, the HR person who is in charge of doing the referrals. But if you make a case, it's possible that they would.
So I guess the question is, why is this something that, and I know it's governmental, non-governmental organizations and private companies that they establish. Why is it something that's worthwhile for them? What's the difference that they see? And I know you work with the HR teams directly, so.
I was gonna say it's very hard for me because in many of these cases, I am the outside counselor, and I am the outside counselor for the purpose of confidentiality and not having any connection to be able to give any doubt to the client that I can go back to their offices, right? So that is my role. I've worked with a few NGOs and it's been very clear. Your work is that of an external counselor. So if you were to be involved with us, then your kind of status and the trust in you might be, waver. So but that's a very, I'll get to your answer. But when I do presentations, you know, a lot of companies will call me and say, you know, we are doing wellness week. I want you to present on workplace, mental health and how to cope and things like that, because I do those regularly. I think for maybe even before COVID, maybe 6 or 7 years, I've been doing many of these presentations. And you hear a lot of feedback from the people who are attending. Sometimes not in vivo, but I tend to leave my email and my phone number on the PowerPoint presentation. And every so often, I'll get a text afterwards, or maybe several texts afterwards, and say, I really appreciate your presentation. I now can see how to address working with these, with my colleagues differently. And you get a sense of, the employees get a sense that, you know, my workplace does care about me. And that is one of the biggest problems that you find. If you were to go into thesis and studies, reports in businesses, you find the same adage: a happy employee is a good employee. So when that's the whole purpose behind an EAP, it's an employee assistance program. It's not therapy for your employees. So some of your employees might need counseling, others might need financial assistance, others might need just spiritual guidance, and it's your place then to kind of see what your employees need. Yeah. Sometimes they fit you to a job. They say, oh, you're maybe you would work better in this other area. Yeah. So it's not just services for counseling, and different companies have different services that they offer to their employees. And that's what is very important to explain, that employee assistance isn't just counseling.
Yeah. Yeah, I know we talked about the fact that some places offer financial literacy if they want to help employees as well. But bringing it back to today, we were talking about how the pandemic has added an entirely new level of stressors
this has been
on
a
people.
2 to 3 year conversation
already. But now when things are going back to regular schedule, I don't say normal, we'll never be the same. It can't be pre-pandemic anything, because we changed. And so when things are going back to a similar schedule or a similar format of what was before, it feels like people are still adjusting. How do you think that's adding an extra layer of mental health challenges to people?
I listen to sometimes different shows on the US radio, like National Public Radio and things like that, and they make jokes about, right now people who work from home have to pick one day to go into the office, and most people are picking Wednesdays. Mm-hmm. And so now offices are trying to make promotions on Wednesdays to bring people into the office, so they'll have wine Wednesdays or or wild Wednesdays or whatever to bring people in. And they say, you know what, people don't want to come in because they want to stay home with their dog, they want to stay home with their kids, and unfortunately, we don't have too many people who have that option in Belize to work from home still continuously. But for a lot of workplaces, it's very important to see the employees working. Mm-hmm. When I see you at your desk, I know that you're completing tasks. Mm-hmm. Whereas if I'm having some workers in the office and some workers at tasks online, then I have to do double work, and I have to check some, and I have to check some in one way and some in another way. So it's a little bit difficult to kind of allow that freedom. But as it comes to transitioning, I want to do these things because I've been doing certain things for a long time. Mm-hmm. And now not only am I adjusting to coming back into the office, but also I have to take several precautions that I'm not used to either. Mm-hmm.
Yeah, so you still have health concerns, you have an adjustment back to something new.
And we have to remember there are some people who still have not been vaccinated for many different reasons. So those people are still at risk.
And just the general upset that the pandemic has caused, I think it's reset a lot of people's mindset about work and about different things in their lives. So when you have this compounded stress going back into the workplace, I mean, would you say that people perhaps really need to be more attentive of their mental health right now as we try to continue?
Well, I would always say that, right? Yeah. I would always say be more aware of your mental health, check in with yourself, check in with the people around you a little bit more. And especially for HR people, that's a real truth. Because as the human resources coordinators, you're the one who has to make sure that people are getting their tasks, because when people have better mental health, they are better employees. You have a lot less absenteeism, which you can check. I think before COVID started, there was a review at the Social Security Board regarding absenteeism. And, we talk about when people are unhappy with work, they'll just take off today because I don't feel like going in. And the more satisfied people are with their work, the happier job satisfaction, the higher job satisfaction is, the more output you have from your employees. So you want to, as HR, it's not just about therapy or financial counseling, but making sure that all your employees are having the highest job satisfaction possible. So if you have a very introverted person as one of your main customer service agents, you know, that person comes home exhausted. Maybe they're doing their job to the best of their ability, but if they're on an off day, that customer service representative is not a good person to be your front person.
So when do you find it necessary to make recommendations to the employer following sessions?
I do it at the end of the contract. So if it's an 8-session contract, I would do it at the midpoint and at the end to make recommendations. Sometimes they need follow-up, sometimes they need financial assistance, sometimes they need to go to a doctor, sometimes, you know, you've been putting off your appointment with a specialist because you can't afford it. Sometimes you need a colonoscopy, you can't afford it, and you're having a lot of tummy issues and things like that. You know, it gets complicated. Sometimes a referral to a psychiatrist would be important. In those cases, I do it as soon as I need it. But in general, I would provide a report at the end. And like I said, you go as a code. I never use your name. But the important thing to remember is I owe my notes to whoever is paying me. And that is something very difficult to understand. When I was doing my internship in the US and I had to write very detailed notes for the insurance companies, people were surprised. But I said, they're the ones who have to know, I have to justify to them why you need continued counseling. And so when it comes to the report in Belize, luckily, a lot of the HR and EAP programs have told me, just give me the basics. I don't need to go into details. You don't need to give me a lot of information. I just need you to justify why this person needs more counseling, or I need you to justify why we paid for the 3 sessions. Or
And just as we start to wrap up, just, you know, what's your advice to people about kind of knowing coping skills for themselves, but also when they should access some additional assistance?
You're putting me on the spot because it's early and I don't remember, but I have a little slide that says, you know, if you notice major changes, if you notice major changes in yourself, in your schedule, in others, if you're finding that you're not eating as usual, maybe you're eating more, maybe you're eating less, maybe you're sleeping more, you're sleeping less. If you find that you're becoming dependent on a substance, and it could be something as simple as coffee, or I'm having like 4 more Cokes in the day. You know, I'm not judging coffee drinkers. They judge me sometimes. But, you know, if you're finding that you need 5 cups of coffee to get through your day, it's still similar to needing to unwind with 5 beers at night. And we judge it differently, but you're pushing through and you're seeing that change. You feel judged right now.
I feel very judged with my caffeine intake.
No, but if it's normal to you, it's normal to you. But
So
when you see that change, and you know, some people need to get through something. There have been occasional people who are referred to me for drinking on the job. If you see that, you know, those are the major things you want to see, any major changes, and that's the easiest way to spot it, and that's how I get a lot of referrals. You know, you used to turn in everything like 2 days early, and now you're like very much cutting it online, you know, putting it to the deadline. And that's how a lot of employers refer employees. It could be something totally unrelated to the job, but it could also be you're starting a lot of quarrels at work. You know, you're usually this easygoing person, but now you're not getting along with 10 people.
All right. Well, this has been very enlightening, and I think everybody has to go to work, and everybody has their own challenges there. But to hear of some workplaces offering programs, that's really encouraging. So I
And
think
to always wrap up, I always like to say, insurance companies offer counseling. The EAPs, your HR people, contact them. You can go to a private counselor. We usually talk about Mind Health Connect having everything in one place. You can also go to the Department of Human Services, the Ministry of Health offer these services as well.
the clinics have services, and also there's the counseling center with
Yep.
community rehabilitation, I believe.
Yes.
So there's a free service available.
And for always, there's a school counselor who can refer you as well, because very often the school counselors refer us, and you have a lot more access to the school counselor as well. If you go to a medical professional, a regular doctor can assist you in getting therapy and counseling services. And we are having a lot more access. Mental health providers are having a lot more access in other communities. It's not just the community and mental health now. We're starting to integrate in our community a lot more.
All right. Well, thank you so much for coming in and having this conversation with us. We are going to go ahead and take a break. When we come back, we'll find out more about the Association of Real Estate Brokers of Belize. That's coming up in a few, so stay tuned.